everyone, and welcome to our USMLE Step 1 Prep Series. This video is brought to you by St. James School of Medicine, so before we go on, please make sure to hit the subscribe button and give this video a big thumbs up. Today we are joined with one of our amazing USMLE counselors, Dr. Russell Heckburn, and he will be going through, is it TB side effects?
Yep, side effects of some of the drugs of TB, tuberculosis treatment. All right, so thanks for introduction. My name is Dr. Russell Heckburn. I'm a USMLE counselor here at St. James School of Medicine. I'm here with my two co-counselors, Dr. Chaudhry and Dr. Kinchlow. And yeah, so this week we're going to be talking about drug side effects. And as per usual, nice little comment there to once again just talk about the fact that you never know what side effects you'll get, so it's always good just to know, or else you'll be like this gentleman here that can't read properly. But let's just jump to the question. All right, so a 45-year-old man comes to the clinic for progressive pain and burning sensation over his feet for the last 2 weeks. A few months ago, the patient applied for a nursing home attendant position requiring the full physical exam and workup. At the time, he was found to have a positive tuberculin skin test and no abnormalities on chest x-ray. The patient was treated appropriately and was advised to continue his regular amlodipine and simvastatin. So what is the most probable medication causing this patient's symptoms today? Let's go through the clues. So I've highlighted a couple of things here, talked about the progressive pain and burning sensation, which is a side effect that the patient is occurring from or is suffering from. So when looking through the medication, you have to consider what medication side effect will cause pain and burning sensations or neuropathy. Also further down, you see positive tuberculin skin test. So he got tested for tuberculosis, and they didn't do, it was positive, so something's up, but the chest x-ray was normal. So so he was treated for this result, and that the result in itself indicates the type of treatment he will receive. But then I underlined the part that he was applied for a nursing home attendant position, which means there's concern about tuberculosis. He got tested for it, something came out positive, got treated for tuberculosis, but he's also on amlodipine and simvastatin. So one of these is causing all the symptoms. And just to kill the suspense, because I know everyone's waiting with the bated breath, the correct answer is E, the last one. The isonicotinic acid, as you can see, is isoniazid. So the first three options before, first one was talking about a calcium channel blocker. That can cause swelling in the legs, but it won't cause neuropathy. The second one, simvastatin, can cause muscle pain, but not the burning sensation that you'll have in the feet. It'll be more like a cramping, localized pain. The third one, which is antibiotics. This is not the antibiotic you will give to this patient to treat for TB, which would either be an aminoglycoside or tetracycline. And the side effects of that are different that cause neuropathy. And same thing, methotrexate can cause some deficiencies and some problems, but just neuropathy is not seen in methotrexate. So because this patient is being treated for TB, one think of a drug that is more TB related, and then kind of look through those drugs, see what side effects can come up from it, and isoniazid, side effect of that is neuropathy. Though we'll explain to you why in a bit, but I'll just kind of run through quickly what tuberculosis is. So just a quick run through, tuberculosis from the bacterial Mycobacterium tuberculosis. It's acid-fast rot, so they're hard to stain and identify, so you have to use a particular stain. Also, because they're algae anaerobes, they're intracellular, and they have the cord factor, they're really hard to kill. That's why the patient got tested for TB, because we want to make sure he doesn't have it, and if he does, we want to treat him before we put him in an environment where he can give it to others. So there's risk factors to who can get it. If you travel to certain areas, if you're in close contact with others for extended period of time, for example, if you're in a nursing home, or if you frequent prisons, volunteer there even, or if you volunteer homeless shelters, you can be exposed to this. And also if you immunocompromise, your body just won't mount a strong response against it, so you can have indolent version of it, not really know you have it, and it'll just be passing off to other people. And it's transmitted by airborne spread. And usually presentation, if you have active TB, then you get like something called B symptoms, which is low-grade fever, night sweats, and weight loss. One clue that will lead you to lung over other things that cause B symptoms is the hemoptysis. They may cough up rust-colored sputum or like red, orange tinged sputum, which is just the bacteria itself affecting the lungs, and then you cough it up and you cough a little bit of blood with it. And if someone presents with these symptoms, with rust-colored sputum, you want to test the sputum for any acid-fast bacteria to rule out tuberculosis, because once again, it's hard to find, hard to treat, hard to kill. I want to make sure we rule it out because can be so dangerous. So this patient who wasn't tested for TB, he was only screened for TB. So how do we screen for TB? You do the tuberculin test or the purified protein derivative test. So you take a little piece of TB, you put it on the surface of the skin, and you leave it there for like 2 to 3 days, and you go back to your doctor, and then they measure the size of it. Depends on what category you fall in, if you're immunocompromised, if you have risk factors or no risk factors, the size of the rash or the inflammation that occurs 2 days after will determine if you're positive or negative. So if you are someone who is high risk, like you're immunocompromised, or you've just been around others that are high risk, or you have a chance of getting it, we want a smaller range. So like 5 or 10 millimeters is what we look for. But if there's no risk factors, we can go the full 15 millimeters to see. So if it's smaller than that, we consider it negative. If it's larger than these parameters, then it's positive. And then if it comes back positive, we do a chest radiograph to see if there's any form of lesions in the lung, which will show evidence of the bacteria itself. So if the lung findings are positive, we consider that active or reactivated TB. We need to treat. We need to treat full regimen, all the drugs. If there's no lung findings, then we give INH or isoniazid, because we consider that latent TB. The skin test came back positive, but there's nothing in the lungs. It's probably hiding somewhere. We want to make sure, and I cannot stress how much we want to make sure TB is gone. Okay, it's that bad. All right, so this is what it looks like. So on the left, you'll see someone injecting some of the purified protein into the skin. We leave it there, check 2 days later, and this is an abnormal test. It is larger than 20 millimeters or 2 centimeters, and then we go back and then we'll have to treat. We'll do a chest x-ray. Based on those findings, we'll determine what type of treatment we get them. So, and this is what a chest x-ray looks like. So in the top corner, you'll see a GON complex, which is reactivated TB. If you have something more in the center where the heart is, on the other side of the heart in the center, I'm not sure if you can see the mouse moving, but if you have it somewhere in the center near the heart, then that's called a primary focus, and that's also considered a positive lung finding. So if the lungs were clean, we'll consider a negative chest x-ray, we treat. But if we find something like this, we want to go and give the full treatment, fully make sure it's fully eradicated, because this is the evidence of TB just being closed off, walled off, and it's just still in the body. So we talked about a lot about treatment options, positive, negative chest x-ray. So if the chest x-ray is positive, you give the full treatment. We call it the right treatment: rifampin, isoniazid, pyrazinamide, ethambutol. We give all 4 for the first 2 months, and then after that, we just switch downgrade to rifampin and isoniazid for the remaining 4 months. There's other conditions, but for step 1, this is really the bread and butter that you need to know. You can stop 1 if there's sensitivity. There's parameters. That's CDC. But for step 1, for studying, just know first 2 months, everything. At the remaining 4 months, you downgrade to just the 2. Latent TB, only isoniazid. And you do that for 9 months. And we supplement with pyridoxine, which is vitamin B6. And the reason we supplement for it is because the medication side effect of isoniazid is B6 deficiency, which is pyridoxine. And that causes a peripheral neuropathy. It also causes anemia. So we want to make sure that when we give an isoniazid, we avoid this side effect, which is avoidable by just giving them a vitamin. In this patient, they have neuropathy. They're being treated for latent TB because the chest x-ray was negative. They're given isoniazid. Now they have neuropathy because of B6 deficiency. How do you treat it? Give them the B6 right back. I've also included here rifampin, pyrazinamide, ethambutol, which also includes the mechanism of action as well as the side effects for them all for everyone to review and go over. It's a lot really to go over. But yeah, definitely take note into this. Rifampin works directly by inhibiting the DNA reproduction, so the bacteria can't replicate. But its side effect is orange body fluids. Isoniazid affects the mycolytic acid wall or membrane, so it can't create that outer membrane. Pyrazidamide, it goes in and goes into the phagal lysosomes, so that makes the lysosomes even stronger, so the macrophages can fight the TB better. And the side effect of that causes hyperuricemia, which can cause gout. And also ethambutol, the last one, it also affects the cell wall formation. And the side effect of that is vision problems. So TB is very important. There's a lot of risk factors. You're going to be asked questions on this. Even in clinic, it's something you have to consider, especially in America where we have a lot of immigrants. So we have to take that into consideration. TB screening test is important, especially working in the healthcare field. So as much as we need to know about TB, we need to know how to treat it and what the consequences of treatment can be, and how do we prepare and manage those side effects. And that's it for me today.
That was a lot of information.
A lot, I know.
But I think I'm ready to take my Step 1 exam.
Yeah.
Throw anything TB at me.
Yeah.
I got it.
I think you got it. Yeah. It's pretty nice. Color-coded a little bit there. So.
Oh, absolutely. Other than that, thank you so much for joining us today. You did an amazing job at breaking down the entire question, and you went past just the side effects of the medication and went really into TB. So I hope this video helped you guys. We look forward to doing another one next week.
All right.
Take care.
Take care, guys.